Sections 812 and 813 are on hazards and risks. There's 5 types of hazards. First one is a biological hazard. There's about 1,400 different pathogens that can impact us. The second is chemical hazards. The third is natural hazards, things like fires, earthquakes, floods, storms, volcanoes. 4 is cultural hazards, so things like unsafe highways, poverty, unsafe working conditions, assault. And 5 is lifestyle choices, smoking, alcohol, drugs, unsafe sex, driving fast, eating poorly. All of these are different hazards. There's ones that are non-transmissible, which are caused by non-living factors, so it doesn't spread. Certain hazards are not, car accidents are not going to spread. This is different from infectious disease, which is transmissible, contagious, and communicable, which is caused by pathogens. There's a bunch of ways in which infectious disease can be transmitted. In a non-living environment, things like wind and water, so you can have inhalation of spores or entry into skin. You can have animal vectors, so things like mosquitoes or fleas can spread different things like malaria or the plague. And then human-to-human transmission. So we're looking at things like direct contact. The pathogen survives best inside the body. Indirect contact, pathogen survives in a harsh environment. Droplets, pathogens are droplets, but don't survive long this way. Airborne, they're aerosols and can stay infective. And then fecal oral through contamination of water or food. One of the things that we're dealing with right now is this coronavirus can be transmitted in many of these ways: direct contact, indirect contact, droplets, and airborne. I haven't heard of it being fecal oral, but all of those makes it hard to contain. We can have an epidemic, which is a regional large-scale outbreak. This first happened in China, it was an epidemic, but a worldwide outbreak is a pandemic, which unfortunately we are all too familiar with right now. These are the deadliest pandemics in history, and hopefully we don't need to add this COVID-19 here yet, but smallpox would be the biggest with 300 million, measles with 200 million, the Spanish flu with 50 to 100 million, the Black Death with 75 million, and HIV AIDS with 25 million. So this is not the first time a pandemic has swept through the country, but it's the first time in quite some time that it has. And so that's why it's such a big thing that we're dealing with right now. If we're looking at the spread of antibiotic resistance, we're seeing that certain different bacteria are really becoming resistant to antibiotics. How does it spread? There's sort of 2 main ways. One is that antibiotics are given to patients, which can result in drug-resistant bacteria developing in the gut. The patient attends that hospital. The drug-resistant bacteria spreads to other patients through poor hygiene, and then it spreads to the general public. Or antibiotics are given to food-producing animals and crops. So the animals develop a drug-resistant bacteria in their gut. The drug-resistant bacteria reaches the human through the food or the environment, or direct human-to-animal contact, and then it spreads to the general public. So this ties in to some of that agriculture unit that we were dealing with. Some causes of antibiotic resistance: we can overprescribe antibiotics. Patients not finishing their treatment. Very, very important to finish your full course of antibiotics. Overuse of antibiotics in livestock and fish farming. Poor infection control in hospitals and clinics. Lack of hygiene and poor sanitation. And lack of new antibiotics being developed. So we'll keep using the same antibiotics over and over. What are some of our solutions to infectious disease? Vaccines are one for sure. Reducing poverty and malnutrition, improving drinking water quality, reducing that unnecessary antibiotic use, reducing the use of antibiotics in livestock, immunizations, and then awareness campaigns for things like STDs and mosquito nets. Toxicity is a measure of the harmfulness of a substance and the ability of that substance to cause injury, illness, or death to a living organism. A dose is the amount of a chemical that a person has ingested, inhaled, or absorbed at one time. So the dose of medicine you take depends on what the medicine is. Sometimes you have a starting dose, sometimes you have a therapeutic dose, or the amount that you need. When you look at giving medicine to children versus adults, there's different doses. And so what factors impact toxicity? Well, some of that is going to be the size, and which is why children have lower doses in order for it to be effective. Other things that impacts what makes something toxic is your genetic makeup. So how sensitive are you to that particular chemical? And then how well do your detox systems perform, your liver, your lungs, your kidney? We've already talked about biomagnification and bioaccumulation, so we can see how things can magnify up through the food chain rather dramatically. And then we have different kinds of responses. So an acute response to something is an immediate, rapid, or possibly temporary, which is different from a chronic response, permanent or long-lasting. We use a lot of times chronic pain, permanent or long-lasting pain, as opposed to an acute injury. So you can have an acute back injury where you hurt your back and it's going to get better in a day or two, and you can have chronic back pain, which is going to last for a long time. Toxicity, according to the EPA, is the maximum level of certain things that we can have. So lead contamination in water cannot exceed 15 parts per billion. Mercury cannot exceed 2 parts per billion. Chromium contamination in water cannot exceed 100 parts per billion. It's crazy that we allow any parts per billion and have a minimum amount. To discuss why is the level of contamination set by the EPA different from pollutant to pollutant? Well, different pollutants will have different effects, and so some are more easily processed, some are more dangerous. And how does the EPA or other agencies come up with these values? Well, they have to do various tests. Many times they're on animals in laboratories, and then we extrapolate that to humans. One of the ways that they do that is what's called an LD50 or an LC50. LD50 is the amount of substance required to kill 50% of the test population. So a lot of times that's referring to mice or rats. And LC is the lethal concentration 50, is the amount of substance in the air or gas or vapor or mist or fume or dissolved in water required to kill 50% of the test population. That could be things like fish or shrimp. Rules of thumb, the results are only applicable to the test population, so they really only work for the population that's tested. And then the lower the amount or the dose, the more lethal the substance. And so this is all tested on rats orally, which means they ate it, and they saw how much detergent that they need to eat in order to kill 50% of the population. So we looked at things like flavoring, moisturizer, stimulant, toothpaste, pesticides. And then they extrapolate that and reduce it. I think they take it down to 10% of what the rat needs, and then scale it up to the weight of a person to make a very, very conservative LD50 for a person. One of the most and least toxic substances on this list, the smaller the number, like that pufferfish poison, that would be the most toxic. And the bigger the number would be the least toxic. So the moisturizer is going to be the least toxic. Is the LD50 directly or inversely proportional? It's going to be opposite. So the smaller the dosage, the more toxic it is. If you're looking at some of the surprising ones, things like caffeine as a stimulant is lower on the list than moisturizer. And then looking at things like fruit flavoring is on there. So checking for understanding, the LD50 of a substance indicates which one of these things. Take a second and look. And it's going to be number 2, the dosage that kills 50% of the test population. The higher the LD50, the more toxic the substance. Was that direct or indirect? False. The less toxic the substance. We have something called a dose response curve. So it illustrates the response of a population to a dose of a chemical toxin. It shows the correlation between the toxin and the effects on that test population. So what percent of the individuals respond in terms of how much dose, and then increasing the dose. So this is 1 aspirin, 2 aspirins, 3 aspirins, 4 aspirins, 5 aspirins, and then at what dose do 50% of the individuals respond? And so it would be however many aspirins we had down here. We can read this same graph for an LD50 and see where does 50% of the population die. And so the graph looks the same whether you're looking at a dose response curve or an LD50 curve. The precautionary principle is when there's substantial preliminary evidence that some sort of activity, technology, chemical substance can harm humans or the environment, we should take precautionary measures to prevent or reduce harm rather than wait for more scientific evidence. Risk is the probability of suffering harm. Risk assessment is using statistics to estimate risk, and risk management is whether and how to reduce risk and at what cost.